Welcome to this unit covering partner coordination. In this unit, we will look at the role of cluster coordination, the Global Outbreak Alert and Response Network, and the emergency medical teams. Partner coordination is a way of ensuring that WHO works with partners to meet the needs of affected people by means that are reliable, effective, and inclusive, and which show respect for human rights and humanitarian principles. WHO conducts coordination as part of the response to plan and deliver activities, to develop networks of teams and individuals with technical or operational expertise that can deploy as part of the response, and outside of the response to develop and strengthen relations with partners. Although it is expected that all of the functions will coordinate with partners and stakeholders as part of their work, there are several groups frequently called on during response for whom coordination is a major part of their role. The ones we concentrate on in this unit are Health Partner Coordination, the Global Outbreak Alert and Response Network, the Emergency Medical Teams, and at the end we'll provide you with a list of the other groups that are involved in partner coordination. The way in which the coordinator works will vary depending on the situation in country. Ideally, the health sector coordinator will be based in the Ministry of Health to provide technical and operational support to help them coordinate activities with stakeholders in needs and risk assessment, advocacy, quality assurance, monitoring, planning, information management and sharing, and service delivery. The Interagency Standing Committee's cluster system is activated in humanitarian emergencies. Sometimes in countries with the cluster system will be mobilized to manage coordination in disease outbreaks and other health emergencies. WHO is the global cluster lead agency. When the health cluster is activated at country level, WHO is usually the cluster lead agency. As the cluster lead agency, WHO represents the health cluster partners on the humanitarian country team, establishes and maintains appropriate humanitarian coordination mechanisms, ensures appropriate technical support to the cluster, and is the provider of last resort. This means that where necessary, and depending on access, security, and availability of funding, the cluster lead must be ready to ensure the provision of services required to fill crucial gaps identified by the cluster and reflected in the humanitarian coordinator-led humanitarian response plan. The Health Cluster Coordinator represents the cluster, including international agencies and national non-governmental organizations, as a whole, coordinates and facilitates the work of the cluster, ensures the accountability and transparency of the cluster's decisions and work, works with co-coordinators, subnational coordinators, health cluster information managers, and other health cluster team members to report to the National Cluster Coordinator, and reports directly to the WHO representative, the HWO, or the designated WHO representative on the HCT. The Health Cluster works with partners building on existing sector coordination systems to collectively prepare for and respond to humanitarian and natural disasters, and is increasingly called on to work in health emergencies. They also work to improve the health outcomes of affected populations through timely, predictable, appropriate, and effective coordinated health action. The health cluster functions support service delivery by providing a platform that ensures service delivery is driven by the humanitarian response plan and strategic priorities, developing mechanisms to eliminate duplication of service delivery. They inform the HC or the HCT's strategic decision-making by preparing needs assessments and analysis of gaps to inform the setting of priorities, identifying and finding solutions for emerging gaps, obstacles or duplication and cross-cutting issues, and formulating priorities on the basis of analysis. They plan and implement cluster strategies by developing sectoral plans, objectives and indicators that directly support realization of the overall response's strategic objectives, applying and adhering to common standards and guidelines, clarifying funding requirements, helping to set priorities and agreeing cluster contributions to the HC's overall humanitarian funding proposals, and monitor and evaluate performance by monitoring and reporting on activities and needs, measuring progress against the cluster strategy and agreed results, and recommending corrective action where necessary. They also have the function of building national capacity in preparedness and contingency planning, and to support robust advocacy by identifying concerns and contributing key information and messages to the HC and HCT, and undertaking advocacy on behalf of the cluster members and affected people. The Global Outbreak Alert and Response Network is a global network of over 200 institutions which provides access to technical experts who can deploy to support WHO member states for outbreak risk assessments, investigations and response. GORN normally deploys individuals to fulfill particular technical roles requested by WHO or the member state. They will be integrated into the teams to which they are assigned. They usually deploy during the response phase, although they have also deployed to support risk assessment and situation analysis. GORN deployees can help with the coordination, strategic and operational planning, provide rapid assessments, field investigations and support to the affected community and health authorities, and provide access to international technical and subject matter expert advice. This table shows the types of staff deployed through the GORN network in 2018 from January to August. Emergency medical teams, or EMTs, are groups of health professionals that provide direct clinical care to populations affected by disasters or outbreaks and emergencies as surge capacity to support the local health system. EMTs are an important part of the global health workforce and have a specific role. Any doctor, nurse or paramedic team coming from another country to practice healthcare in an emergency needs to come as a member of a team. EMTs must strive for self-sufficiency, meeting minimum standards for EMTs, and provide quality of care that is appropriate for the context. The WHO Emergency Medical Teams Initiative assists organizations and member states to build capacity to strengthen health systems and coordinate the deployment of quality-assured medical teams in emergencies. The WHO EMT Initiative enables countries to improve their national capacity, enables affected countries to accept and use EMTs in a timely, coordinated manner, sets a certified safe minimum standard for clinical teams to operate at to support host governments and affected populations, and coordinates the deployment of EMTs in a country to ensure their skill set best matches the needs of the affected population. The tasks of the EMT Coordination Cell are collecting and updating data for the classification of the actual type, capability and services of the incoming EMTs, screening incoming EMTs based on approved global professional standards leading to on-site deployment, national registration of authorized EMTs based on the global classification and registration formats, and ensuring and reinforcing the EMT's accountability to the health authorities, including compliance with existing or national guidelines and reporting requirements. Providing background and up-to-date information on the situation and assigning a place of operations and local reporting liaison contact. Providing sound and valuable support to speed up all the related authorizations for authorized EMTs. Providing standardized forms for periodic reporting, exit reporting, and referral of patients to the national facilities. And providing and supporting the strategic and operational framework of the EMT's response. They also formulate priorities on the basis of analysis, conduct mapping of who does what, where and when, and how through the quality assurance field visits, and inform the National Emergency Management Authority and other national or international authorities to ensure the embedding in the broader health sector emergency coordination. Here are some resources for you to look at the other important WHO networks and partnerships for deployment in health emergencies. Thank you.